Good morning. Today we will demonstrate the longest and the strongest bone of the body, which is femur. It is a bone of the inferior extremity, and femur is about 45 centimeter or 18 inches long in an average 6 feet person. Now it is a long bone because it helps in weight transmission. So it has upper end, it has an intervening shaft, and it has lower end, which consists of two condyles. Now let us first know the major bony features of femur in order to hold it in anatomical position and also to determine the site. So this is the anterior aspect of the bone, this is the posterior aspect of the bone, this is the upper end, and this is the lower end, which consists of two condyles, the medial and the lateral condyles. Now first let us concentrate at the upper end of the bone. The upper end of the bone, as you can see, consists of a circular head, a constricted neck. It has a quadrangular bony buttress, which is called the greater trochanter, and a conical small bony projection, which is called the lesser trochanter. Now, how to hold the bone in anatomical position and how to determine the site. In the anatomical position, the head should be directed medially. The greater trochanter will be directed laterally. At the posterior aspect of the shaft, we can see a rough ridge, which is called the linea aspera. This is called the linea aspera, which is present at the middle of the posterior surface of the shaft, and the two condyles, the medial and the lateral condyles, will be projected backwards in the anatomical position. Now, in order to hold the bone in anatomical position, we have to first fix the bone on a horizontal surface like this. Now, in the anatomical position, so this is the anatomical position of femur, as you can see. So in the anatomical position, the head is directed upwards and medially. The greater trochanter is directed laterally. The lesser trochanter is directed medially. At the posterior aspect of the shaft, we can see the linea aspera, and the two condyles are directed laterally. So this is the anatomical position of femur. And you can see that the axis of the bone is inclined, it is not straight. When we hold it in a horizontal position, the axis becomes inclined. Now let us come to the upper part of the bone. The head articulates with the acetabulum of the hip bone to form the hip joint. At the center of the rounded head, there is a pit or fovea for the attachment of the ligament of femur. Next, there is a constricted neck. Now the neck is having upper border, it has lower border, it has anterior surface, and it has posterior surface. So the neck has upper border, lower border, anterior surface, and posterior surface. Now the neck makes, the long axis of the neck makes an angle with the long axis of the shaft, which is called the neck shaft angle, and it is about 125 degree in an adult. Now at the anterior surface of the neck, there is an intertrochanteric line which runs in between the greater and the lesser trochanter. So at the anterior surface, there is intertrochanteric line. Now let us come to the posterior surface. At the posterior surface, this is called the intertrochanteric crest. This is the intertrochanteric crest, and the middle of the intertrochanteric crest, we can see a bony elevation which is called the quadrate tubercle. So this is called the quadrate tubercle. Now this is a lesser trochanter, which is a conical, small conical projection, which is directed medially in the anatomical position. Now this is the greater trochanter. So the greater trochanter is having anterior border. So this is the anterior border of the greater trochanter. It is having an upper border and the upper border is continuous behind again as the posterior border. So the greater trochanter is having anterior border, upper border and posterior border, and it has two surfaces. This is a lateral surface and this is the medial surface having a depression or a pit or fovea. So the lateral surface, as you can see, is divided by an oblique ridge. It is divided by an oblique ridge which comes downwards and forwards like this and divides this quadrangular area into a upper triangular and a lower triangular area. Now let us come to the shaft. Now the shaft, for the purpose of description, we will first describe the middle 1/3 of the shaft. For the purpose of description, we will first describe the middle 1/3 of the shaft, then we will describe the upper 1/3 and then we will describe the lower 1/3 of the shaft. Now since it is a long bone and it is having a shaft, so it has borders and surfaces. Now as we can see, it has a medial border which is rounded. It has a medial border which is rounded. It has a lateral border also which is rounded. So the middle of the shaft is divided into three surfaces. What are the three surfaces? It has an anterior surface, it has a medial surface and it has a lateral surface. It has a posterior border. The three surfaces are divided by three borders. This is a rounded medial border, this is the rounded lateral border and posteriorly this is called linea aspera. Posteriorly, this bony ridge, this longitudinal bony ridge is called linea aspera. Now the linea aspera is having a medial lip, it is having a lateral lip and it is having a floor for the attachment of different muscles of different compartments of the thigh region. So this region in the middle of the shaft, this bony longitudinal ridge is called linea aspera, having a floor and medial and the lateral lips. So the middle of the shaft is divided into three surfaces by three borders. Now let us come to the upper part of the shaft. Now at the upper part of the shaft we find a fourth surface which is called the posterior surface. So this is a posterior surface. Other than the anterior surface, medial surface and lateral surface, at the upper end of the bone we have a fourth surface which is called the posterior surface. Now the posterior surface is bounded by two distinct lines. One is called the spiral line. This is the spiral line which is present medially and it is continuous with the medial lip of linea aspera. So if we trace the medial lip of linea aspera upwards, we see a bony curved line which is going again to the anterior surface. So this is called the spiral line. Now if we come to the lateral aspect of the bone, we can see another bony ridge which is called the gluteal tuberosity. This is called the gluteal tuberosity. Now the gluteal tuberosity, if we trace below, is continuous with the lateral lip of linea aspera. So the gluteal tuberosity is continuous with the lateral lip of linea aspera. So the posterior surface of upper 1/3 of the shaft is bounded by the spiral line on medial aspect and by the gluteal tuberosity on the lateral aspect. Now we come to the lower end, the lower 1/3 of the shaft. So this is a lower 1/3 of the shaft which is having a triangular posterior surface. This is a distinct triangular area which is called the popliteal fossa. So this lower 1/3 is having the fourth surface which is called the popliteal fossa, which is called the popliteal surface, and it forms the floor of the popliteal fossa present at the back of the thigh. Now what is the boundary of this popliteal fossa? Now if we trace the medial lip of linea aspera, so this is the medial lip of linea aspera, I am tracing it downwards. Below it forms a sharp line which is called the medial supracondylar line. This is the medial condyle. So above the medial condyle, this sharp line is called the medial supracondylar line. This is a lateral condyle of femur. And if we go above the lateral condyle, this sharp ridge is called the lateral supracondylar line. So it is bounded, the popliteal surface is bounded medially and laterally by the medial and lateral supracondylar lines. These are the two condyles, the medial and the lateral condyles. If you see like this, you can see that the medial condyle, this is the anterior aspect of the condyles, and the smooth surface is for articulation with tibia. The smooth surface is for articulation with tibia. As you can see here, the medial condyle is a bit larger, is a bit larger as compared to the lateral condyle. Now the two condyles are projected backwards. Now this is a medial condyle. Medial condyle is having a medial surface, a lateral surface, and an articulating anterior surface. So this is the articulating anterior surface. Now let us come to the medial side. At the medial side, we can see there is a bony projection. At the medial side, we can see there is a bony projection which is called the medial epicondyle. It is called the maximum point of projection is called the medial epicondyle, and above the medial epicondyle we can see another bony buttress which is called the adductor tubercle. So we have the medial epicondyle, and just above it we can see another bony buttress which is called the adductor tubercle. So these two are the features of the medial side of medial condyle. Now this is the lateral surface of the medial condyle which forms the medial boundary of the fossa which is present in between the two condyles. So this fossa is called the intercondylar fossa. So this forms the medial boundary of the intercondylar fossa. This is the lateral condyle. Lateral condyle is having a medial surface and a lateral surface and anterior surface which articulates with tibia. Now this medial surface forms the lateral boundary of this fossa. Now let us come to the lateral surface. At the lateral surface we can see a point of projection which is called the lateral epicondyle. Just above the projection there is a small depression. Just above it there is a small depression which is for the attachment of the lateral head of gastrocnemius muscle. Below you can see there is a groove which is running. This is a groove which is running. The anterior part of the grooves gives attachment or lodges the tendon of it lodges the popliteus muscle, and posterior part of the groove lodges the tendon of popliteus in flexion of the knee joint. So anteriorly we have the muscle and posteriorly we have the tendon of popliteus in flexion of the knee joint. Now just above the medial epicondyle there is a small projection which is called the adductor tubercle for the attachment of ischial fibers of adductor magnus, and here we have the attachment of the tibial collateral ligament. Here at the lateral epicondyle we have the attachment of the fibular collateral ligament. So we have here the tibial collateral ligament, and the lateral aspect we have the fibular collateral ligament. Here we have ischial fibers of adductor magnus at the adductor tubercle, and below the groove here we are having the popliteus muscle and the popliteus tendon. Now let us come to the attachments. Let us start discussion about the attachment. Surrounding the neck we will have the capsular ligament of the hip joint. So surrounding the head we will have the capsule of the hip joint. Here we have a ligament which is called the ligament of femur. through this ligament, the branches of the obturator vessels will come and supply the head of femur. This is the lesser trochanter. Here at the buttress, at the conical buttress, we have psoas major, and just below it we are having another small muscle which is called iliacus. So this is psoas major, and here we have iliacus. Now at the quadrate tubercle, as the name suggests, we are having attachment of the quadratus femoris. At the gluteal tuberosity, we are having the fibers of gluteus maximus muscle. At the gluteal tuberosity, we are having the gluteus maximus muscle. Now let us come to the upper end. So this is the intertrochanteric line. So encroaching on the intertrochanteric line, on the lateral aspect, this muscle is vastus lateralis. Along the medial aspect, this is vastus medialis, and throughout the upper part of the shaft, along the whole of the anterior surface and partly along the medial surface, this large muscle is vastus intermedius. So from the upper end of the shaft up to almost the middle 2/3 of the shaft, along the anterior surface and also along the lateral surface, we are having the vastus intermedius muscle. Now let us come to the anterior border of the greater trochanter. So this is the anterior border of the greater trochanter. At the upper border, we are having the bursa for gluteus minimus muscle, and at the lower border we are having the fibers of the gluteus minimus muscle. Let us come to the lateral aspect. The lateral aspect is divided by an oblique ridge into upper and the lower triangular area. This oblique ridge gives attachment to the gluteus medius muscle, and below and above we are having bursa for the gluteus maximus muscle and for the gluteus medius muscle. Now let us concentrate at the upper border. At the upper border, we are having the following muscles from anterior to posterior. We are having the first muscle. The first muscle here we have is piriformis. The first muscle we are having here is piriformis at the upper border. Then we have gemellus superior, obturator internus and gemellus inferior. So from anterior to posterior, the muscles present at the upper border of greater trochanter are piriformis, gemellus superior, obturator internus and gemellus inferior. At the medial aspect of the pit or the fovea, there is obturator externus muscle. So we are having here, we are having the obturator externus muscle. Now in the next video we will discuss about the rest of the attachment present at the shaft and at the lower end of femur. Thank you.